Now we start scanning the scrotum. This is left testis. It shows heterogeneous texture or increased echogenicity. The size of left testis is also mildly increased. When there is inflammation in the testis, the internal flow is also increased. Here we see the internal flow of left testis is markedly increased. When the testis is normal, the internal flow will be minimal. This is epididymis, which also shows increased echogenicity due to inflammation. And this is spermatic cord, which shows heterogeneous texture and increase in size and increased echogenicity. Here we also see a hypoechoic areas which contain debris. Now when we scanning the epididymis, here we see heterogeneous area. This is body of epididymis, which is inflamed and thickened. And this is tail of epididymis, which is thickened and increased in size and shows heterogeneous texture. The body and tail of epididymis is markedly inflamed. And here we see fluid containing debris in the tail. This is right testis. It also shows heterogeneous texture and increased echogenicity. Here we see a hypoechoic area, which is cyst. The right epididymis and spermatic cord also shows mildly increased echogenicity. On color Doppler, we see increased flow in the right testis due to inflammation. Here we see the body and tail of right epididymis, which also mildly increase in size. Here we see the free fluid, which contain debris. Now we will measure the size of cyst. The size of cyst is 5 into 3.4 millimeter. Now we will measure the size of scrotal skin, which appears to be normal and not inflamed. The size of scrotal skin is 4.9 millimeter and the normal size is up to 6 millimeter. Now how we will write report.